Hello.
Afternoon to everyone. We have Mr. Felix on the line, and we thank everyone for joining in today. Today's show will be looking on something different that a lot of people find it difficult to understand. We have our guest here by the name of Felix. Felix, can you introduce yourself and your company, and where actually do you come from, basically in Africa?
Hello. My name is Felix. Felix Made, originally from the Republic of South Sudan. I came to South Africa in the year 2008 at literally tender age. I studied at Wits University with Masters of Science in Epidemiology and Biostatistics, literally public health. I'm currently completing my PhD in public health as well. And I formed a company called Sub-Saharan African Public Health Research Consultancy, which is basically dealing with research focus in the Sub-Saharan Africa region. That's all about me briefly. Back to you, Mister.
Okay. All right. So tell us here. What services does your company actually offer?
Okay, what my company does is it conducts public health research on the epidemiology of diseases. These diseases can be communicable disease. When I'm talking about communicable, I'm meaning infectious disease that can be transmitted from one person to another. Just as coronavirus, it can be HIV/AIDS, it can be TB, and other diseases that exist, and also non-communicable disease. When we're talking about non-communicable disease, we're talking about hypertension or high blood pressure, diabetic, which is high glucose level, cancer, and obesity. These are diseases that cannot be transmitted. That's why they are called non-communicable diseases, and they are very common among us in the population. Our aim is also to develop strategies and also implementation frameworks that can help in preventing diseases, influencing social and behavior change, and communication among people, with overall aim of improving health of communities in the region. Thank you.
Okay. Now, basically, what made you actually to study this course? Out of all these courses, what made you to study this course?
One of the reasons why I studied this course was because there was scarcity of skills in South Africa, in an African region, on specialized skills that deals with data. I think by the time I was starting the course, we were literally, less than about 20 people that have the qualification in the whole of South Africa. And so there was a huge gap of getting young Africans to do this course so that we can have that specialized skills of changing data into information. Because data itself, for example, when you go to the population and ask about their health status, you're just asking a random question. It becomes a data, but then you need to find a new way of taking this data into information. And that is the skills that we are thoroughly lacking in the region. And that's why I went and did this course so that I can become one of the few people with actually the skills that can be able to help improve lives and health in Sub-Saharan Africa.
Okay, all right, I understand. Let me ask you this question so that we can move into our main question. Now, tell us about your partners, the two universities which you have partnered with them, and where are these universities based, and what are your relationship with these two universities, and what are the names of those universities?
The first university I'm partnering with is University of Wits School of Public Health, where I got my expertise from, and some of my mentors, some of the best in the continent, are from that university that mentored me up and supervises my research and public health research work at master's level. And they are the center of public health research actually in Africa, and that's where the partnership come from. The other one is University of North Umbra. That's where I have my professor of biostatistics, in public health, based in the United Kingdom, who happened to be my supervisor for my PhD, which is actually based in public health as well, with special emphasis in biostatistics, which deals with analysis of data and taking data into evidence-based information system. So he is based that side, and I am based here. Thank you.
All right. Now, tell us here, what are the roles of researchers in the sub-Saharan Africa, or maybe in the world? The roles of researchers.
The role of a researcher is basically, for example, if I give you an example of why Ramaphosa is standing on the podium for family meeting, on the podium for family meeting about COVID-19, behind the scenes are the researchers. So those researchers are important to see if we move, for example, from level 5 to level 4, what are the impacts? Is this going to actually decrease the number of transmission or increase? At what level is the decrease not so big enough that it won't have a very bad impact on the population? So that's the role of researcher. For the president to do that, he needs to contact researchers who will be able to gather data and assess and focus exactly the impact of this various stage of lockdown before a decision is made, while balancing with increased number of transmission of infection, at the same time also balancing with the economic impact. So you need a researcher in that instant to be able to analytically, synthetically do this work and give you information that is purely based on data. You understand? That's basically the role of researchers here.
Okay, I understand, Mr. Phillips. Now, tell us here, a lot of people, they get confused. You need to explain to them that what is the importance of data management?
Data management is very important, because if you don't manage your data properly and then you end up giving false information to the audience. So data management comes in handy. For example, when you collect data, the data once it's collected is dirty. So once it's dirty, it means that you need to be able to clean it. For example, if you collect 5,000 data, of 5,000 data, you find only 2,000 are actually usable. So if only 2,000 out of 5,000 data are usable, are 2,000 data enough to be able to give back information to the whole community? It's a yes/no answer. So that's why you need skills of data management to be able to thoroughly clean data and synthesize and be able to relate this data. For example, if you collect data from one person at 3 different times, you need to be able to have a record that you can link this person together to that one problem, so that you can be able to follow this person up time to time to say exactly whether.
Sorry, based while you're still on this one, while you're still on this one, I just want to ask something. So why actually data should be managed? So you're saying that if one give wrong information, it's going to be a problem. If you report false information, it's going to be a problem, because there are people are going to take decisions based on your data.
Yes, exactly. That's why when you are asking information from someone, for example, if you ask someone, are you HIV positive or not? And the person say no, they are not HIV positive. And then the second question is, when last did you take your ARV? And then they told you that they took their ARV 2 months ago. But the first question, they said they are not HIV positive. You understand? So that's where data skills come in handy. Yes. That's what data skills come in handy. To be able to relate that, so that you collect a really truthful results, information that at the end of the day, when policymakers sit down to make a decision, they make sure they make a decision that is not going to backfire back to the community, but in turn it helps to improve the lives of community based on data quality and data consistencies that you work on.
Definitely, we hope the listeners, they are listening, even those who are listening from different countries, we hope they can see actually that it's very much important for people to take the career of being a researchers importantly. So I can also ask, what is epidemiology researcher and also the biostatistics researcher? Can you start by explaining the one of epidemiology researcher and also the biostatistics researcher?
And epidemiology is
biostatistics services.
And an epidemiology is someone who do study on the distribution or frequencies and patterns or determinants. When you talk about determinants, you're talking about the cause. For example, what is the cause of high HIV rates in Genfes, for example, or what is the cause of high HIV rate in Gauteng? That's the determinants. So epidemiology do the study of the determinants and the distribution. The distribution you're talking about is how many percentage of people in Gauteng that has got HIV, in KwaZulu-Natal, in the Western Cape, in the Northern Cape. That become the distribution, and the determinants are the causes. Is it poor risky behavior? Is it high alcohol intake, or is it poor leadership? You understand? This can be related health state. It can be events. It's not just about disease when you talk about epidemiology. It can be general events, like the cyclone that is happening as well in a very specific population. That is epidemiology. So the biostatistics part is now using the data, having a special skill, analytical skills of analyzing that data while removing all the bias from that data into information and interpreting it accurately so that it can be used to inform policies and change things in our communities.
Okay, Now let's look at the biostatistics, biostatistics services. What does that mean actually?
The biostatistics services actually starts right from data collection. The data needed to be collected accurately. Data instrument, which can be questionnaires in form of paper or in electronic, have to be developed appropriately for a specific research, and it has to be reviewed. And then you have to now do analysis, which can be using complex statistical analysis methods or basic analysis method that you can use that take into account errors, bias that can be systematic or random. You understand? And also at the same time, having this data in a quantity that is enough statistically that when you have the result, you can be able to say this applies to the whole of the population in South Africa. Thank you.
Okay, now I definitely understand, and now I can see the difference between the two. Now, Can you explain to all the listeners that why is epidemiology important?
Why is epidemiology important? Epidemiology is very important because without epidemiology at first, right now, we would be overrun by COVID-19. You understand? Because, for example, right now, the government, every week, we're producing reports on number of healthcare workers that are infected with COVID-19 and that are admitted in the hospital. Actually, our study are showing that the Eastern Cape has got high number of people that are admitted with COVID-19, but then the high number of people, healthcare workers that die from COVID-19 are in Gauteng and KwaZulu-Natal. So this is the importance of this case. Without taking this data and trying to synthesize to this short form information, government won't know exactly where they must put their efforts in combating the spread of coronavirus, or even in distributing PPEs and putting more attentive measures in place in a specific province so that the healthcare workers are not heavily affected by COVID-19. So the importance of epidemiology is to determine this kind of distribution patterns of disease or death in each province or in a region, so that we can know exactly where are the hotspots, and then we go and tap into that hotspot.
So basically, while we're still digesting this one, I see two people here. I see two listeners here. They are sending questions, but they're not sending their names. I just want to read out those two questions so that while you are busy digesting this one, you can also take them into consideration. The first one is that how does epidemiology, how does it help in terms of researching? And the other one is that what is the function of epidemiology?
The function of how does epidemiology help in terms of researching? Epidemiology helps in
Definitely.
a way.
Actually, they just need in terms of researching, and also they need to know the function.
Yeah, the function of an epidemiologist is someone who have to gather information on frequencies and patterns of diseases or events. These events can be death. You understand? So the key is that epidemiology comes in handy in a way that you will be able to know in a community which health disease is of particular importance that need to be addressed. Is it, for example, if you are talking about diseases, is it HIV that is the major problem, or is the cancer? And then now, if you find HIV is a major problem, now what is causing the increased rate of HIV? Is it alcoholic intake, drinking, cigarette smoking, night clubbing, or lack of youth support system in that community? You understand? So this information, once you collect it, they are vague until when an epidemiologist come and put them in their pieces together in form of graphs, in form of analysis combined with a statistician, so that you have that information and say, okay, no, in Gauteng, if you can reduce the sale of alcohol, you are going to reduce the number of HIV infection by this much. You understand? So that is the importance and generally the function of epidemiology in our society.
Yeah. Now we can see that. So I can also ask this question again, like, what is the role of biostatistics in drug development?
That's a little bit complex and advanced. Biostatistics in drugs development is very important because, when you are developing a drug, you actually develop a drug and you want to, for example, see whether this drug is actually working. So you have one drug that you develop in form of a capsule form. You want to test whether it is working. But remember, before you do this, you need to do underlying studies. For example, maybe you tested these drugs in animals or in rats and it's not killing them. Because at the end of the day, these drugs must not be harmful. So once you finish that stage, you come into now testing in humans. That's where you bring your biostatistics in handy. You say, no, I'm going to make 2 drugs. The other one is going to be the real drugs. The same capsule, if they are white, is white. The other one is also white, but it's just a food supplement that is placed inside there. So now you take people that have the disease. Now you give them this drug. Some other people, you give them the one that doesn't have the drug. We call it placebo. And then the other one, you give the one that actually has the drug. And then you monitor them over the time to say who recovers. You understand? So now from there, you can be able to statistically assess what is the effect or the efficacy of this drug on this patient. If you see that the people who just took the tablet without anything, is just food supplement, did not recover, but the one who took the drug recovered, and then it means that the drug is the correct one. But in most cases, you'll find that both of them recover somehow. So statistically, biostatistics now come in handy to say, is this drug, did it make actually a certain percentage that is good enough to distribute to the pharmacists, to the people to take it or not? So you need to assess that statistically, biostatistically, you need to investigate that. So that is the advantage of biostatistics in drugs development or vaccines.
So okay. Now I understand. So what does actually, biostatistics actually deal with? Because you explained earlier on, but I see someone is also asking a question. I'm not sure if maybe the person did not understand. The person is saying that, what does biostatistics actually deal with? I think you did try to explain actually, but you can also answer it.
Biostatistics is derived from, there are 2 different words. Bio is biological, which is health or medicine, and statistics, which is conventional mathematical. So it means you apply mathematical derivative in analysis of health data. So biostatistics is basically analysis of data. Statistical analysis is a skill that you have to acquire to be able to analyze data. You convert data into information. That is biostatistics.
Yeah. So if I can also ask something here. Now, what is the importance of statistics in the medical services?
Statistics is very important in medical pharmacy because first it can allow you to focus whether, for example, level 5 lockdown was effective or not, even before level 5 lockdown can start. Or it can allow you to say, okay, if we move back to level 5 lockdown, is it going to be effective? You understand? So in a medical sense, the level 5 lockdown, you can be able to analyze using a small data to see how much of impact it can have if it's brought back in reducing the number of infections from coronavirus. So those are one of the elements of importance for biostatistics. The second importance of biostatistics is also help you, like just you said, in drug development or in clinical trials to see whether a vaccine is actually going to be working for treatment or for prevention of certain infections. So you also apply that biostatistical skills in that area by using a robust method that I don't want to go deep into because I guess that some of the audience may not be able to understand it. But all those elements of medical fields requires you to have that in-depth knowledge of biostatistics and also at the same time the knowledge of epidemiology.
Okay, so actually, what are actually are the data management skills?
The data management skills that you need to really develop is how to manage your data, how to clean the data, how to look at your missing values, how to look at data inconsistencies. For example, what I told you right now, someone says they're not HIV positive, but they last took their medication 2 weeks ago. And then you need to be able to say how you can store this data in a way that is not lost and you can be able to use it for future reuse in case if you want to go back to confirm exactly your results, what you had to do. So those are basically data management, which is about cleaning the data, developing appropriate data storage tools like using RedCap, and also looking at missing values, data inconsistencies, and trying to make sure that the data is robust enough to be able to produce the required information that you need.
Okay. Now, I want to tackle... sorry about that. I want us to tackle this one. I have two of them here. One is saying that one is saying that I think this one we did answer, but I'm just gonna read them for you. One is saying that what is the use of data management, and also what is data management job?
So when you are a data manager, what you are required to do is you are required to design, to develop and maintain data collection tools. You are required to also maintain databases to ensure that there is data quality and data inconsistencies. And then you are also required to make a recommendation for specific software and hardware, you understand? For example, do you want to use MicroStrategy, Tabuli, Python? Do you want to use SQL for your data management skills? You understand? So when you are employed as a data manager, that's what you are required to do, to make sure there's data security. Sometimes you have to develop a system where the whole organization, staff members have to log in and just enter. You design a question that they enter and the whole information comes to you. You understand? And then you'll be able to group it to say, this number of staff says no, they are not happy. This number says they are overly happy. This number says they don't know. You understand? It all have to come to you as a data manager. You understand? So you need to be able to develop a system that can be able to go around your organizational system without ever having to collapse.
Okay. Now I see a question here. Hey, this one is a long one. I'm just going to try to summarize it. It's one of the listeners here saying that it's Motale Pule. She's listening all the way from Botswana. So she's saying that she really appreciates the initiative of Go Youth FM bringing people like Mr. Phillips. And Felix, what she's also saying, she's saying that she's asking a question that since you started this company, she just wants clarity. She's also saying she also wants you to clarify where is your original country in Africa, where actually originate in Africa. And also she's saying that she's also saying that since you started the company, what actually campaigns have you been working on, and can you share at least one of the campaigns that you worked on and some of the difficulties, and what did you enjoy about working about some of those campaigns? It's Mutlalebule from Botswana.
Okay, hi Matapule, thanks for that question. I'm original from the Republic of South Sudan, which is literally a very new country. I'm not sure if very many people know it, but it's there in the very top of Africa, that side near Egypt. Since I started the company, I haven't really done so much because I'm also still pushing on my PhD. But however, one thing that I've done was I was contracted to do a very short study on compensation to develop a predictive model to compensate miners who died from silicosis. So these miners died a long time ago, but there is not sure whether they actually died from silicosis or not. And their families need to be compensated by some mining companies in South Africa. So the challenge is you have over 1,000 people death records whose family are still alive and they are asking for answers. They are not compensated. And you have records of people who actually were diagnosed, confirmed by doctor, that they died from silicosis or silica dust by working in gold mines over the years, way before 1994. So the challenge is now, how do you get into bottom of this? Because you are tasked with this, and you have to be very careful that any result that you produce, unfortunately, is not going to compensate everybody, but it has to compensate some. But you have to produce a result that is almost certainly beyond reasonable doubt that these people who didn't have information before can actually possibly died from silicosis or silica dust, that they need to be compensated. So the only information you have about them is their age, their gender, and their years of work only. But you don't know whether they died from silicosis-related disease like TB or mesothelioma, for that matter, using data from those one who died from this disease that were already confirmed by doctor and laboratory diagnosis. So that was one of the major challenges that we met. Unfortunately enough, we passed through that challenge and we managed to get a few number of people in a few hundreds that were actually agreed by the mining company, the consulting mining company, to compensate those families that lost their loved ones. Thank you.
All right. Yeah, I see a lot of people, Felix. A lot of people, they're very happy here. I see they're sending high five. I see people like, it looks like they're happy. Some of them, they're saying that we need this guy to come on the show each and every week. I see here we have a guy here by the name of, it's written just MMJ. So he's specifically saying that Go Youth FM must make sure that they hold this guy. We need this guy each and every week to give us something. And then the other one that I see here is from Anonymous. The Anonymous, I'm not sure it's a she or a he, saying that Mr. Phillips, what is your view on the situation of the COVID-19, especially in South Africa and the sub-Saharan Africa? What is your view, and what can you say? Because we are all lost.
I think that my view can be clear. COVID-19 is real, and the new variants that just came in is more dangerous. It spreads very fast, and it can easily take you to hospital. So Africa and Sub-Saharan Africa in particular, we need to practice social distancing. We need to always be careful and avoid crowd if we can, and always do all the measures that needed to be done to prevent COVID-19. I always say, it's like the World Health Organization have always said, that prevention is better than cure. So the best thing I think we should do with COVID-19 is to try as much as possible to prevent by wearing masks, washing hands regularly. And I also think, this is from my personal view, that things like, for example, keeping yourself warm by taking hot water most of the time with tea, lemon and ginger and ABC, all these remedies that are important. I think we should always keep taking them. And always the most important thing is our mental attitude. You need to be positive and always be positive about this COVID-19. Know that it's real and do not be scared when the vaccine comes. That all of us be able to take this vaccine. We should not be scared. It's not meant to kill, but it's meant to prevent. So that's the very few thing that I think about COVID-19. Unfortunately, recently we just lost, I think actually 2 days ago, we just lost one of our work colleagues, actually a 28-year-old who just died of COVID-19, who got the disease just on the 11th of January and died this Thursday. So COVID-19 is real, guys, and let's be careful about it. Try to prevent. Let's have the right mental attitude. Let's exercise. Always eat healthy exercise. Make sure your heart is pumping very hard sometimes, because your blood needs to circulate nicely to provide you with energy and oxygen that you need in your system to be able to fight and prevent this disease. But avoid crowd, guys. Really, let's do avoid crowd.
So, and I can see here. What can you say, Mr. Felix? Because I see someone here is asking that if one finds him or herself in a situation whereby maybe one might be positive but not being sure but having the symptoms, what is, from your personal view, what can that person do, especially looking that the person is coming from a rural place?
From my personal point of view, from my own experience, I was feeling unwell for a week. I tried to take some medication like Felix and some flu tablets, but it was not really helping. For the whole week, I had flu, cough, headache, and sore throat like that, which is typically COVID-19 symptoms. And then I went for test. But in the process of all this, I never felt like I have COVID-19. I was never panicking. So that's why it is very important to have a very strong mental attitude about this disease. It's just something, if it gets to you, it gets to you, but it's not something that you should panic about, because sometimes what takes you quickly to being really very sick and end up in hospital is the mind. If you're too scared about it once you have it, or if you thought you have it, and then that is very bad. Sometimes it's not COVID-19, it's something else, but at the end of the day, it may end up disrupting your system and you end up actually falling very sick. So I was very confident. I didn't know, I'm not sure whether I have it or not, but I was not worried about it at all. I was still doing my normal routine, going to exercise, coming back, taking my hot water and taking my medication, watching movies and being free. I just didn't go to work. And then I decided, no, let me go and test. I went and did the test, and the same day the test result came back, it was negative.
Yeah.
You see?
Yeah.
And then on the following day, actually, all my symptoms started disappearing. Today, I don't have the symptom, literally. Yeah, so it's something that you need to be strong about. If you have it, be strong. Yeah, so long as it didn't put you down, exercise, be jogging, be happy, smile out there in your house until it sees it. Yeah.
I hope all the listeners, they're enjoying the show. This is Go Youth FM, and I can see that more love coming for you. And I see a lot of people are enjoying the show, and I see just about about 150 people just joined in less than 5 minutes. I see that at the moment, the current number of people who are listening online is around 3,201. Those who are attending in actually online now. This is amazing. I have never seen such a number of people. This is amazing. I'm telling you, I have never seen such a number of people. In most cases, it's roughly 2,000. But today, I'm telling you, it's a high number, the one that we're seeing here. Now, Mr. Phillips, in conclusion, how can people find you? How can companies that need your services find you? When are you available? How can they find you on social media? Do you have a website where they can get contact with you? How can they get in contact with you? Especially most of those companies, how can they get in contact with you?
Yeah, to get in contact with me is very easy. You can always drop us an email at info@ssaphrc info@ssapsaranaafrica.com. At info, you can drop me email at info@ssaphrc.com, or alternatively you can visit our website as well on www.ssaphrc.com. There you can find our email address as well. You can drop us the email, or you can call me on +277 33889
That's good. Now,
so we are available. Also, we're on LinkedIn. When you search for Sub-Saharan Africa Public Health Research Consultancy on LinkedIn, you'll be able to get our link and drop us a message. I think anytime we should be available to help wherever we can. Thank you.
All right, this is Go Youth FM. We had Mr. Phillips on the line, who was busy actually explaining, today we're deep into science. And I hope a lot of people, they understand actually what we're talking about. But this is not the first day. It's not the first day, not the last day. We'll be having Mr. Phillips moving forward. He'll be coming with different shows, different programs explaining so that people can understand. Mr. Phillips, we appreciate you and we thank you. What's your last words to all the listeners? I see a lot of them are coming. Now we are at 4,100. The number is increasing very fast. People are, I don't know if people are telling each other that, hey, they show. So
that's what it is.
Yeah, what's the last word?
Have the right mental attitude about life, about any disease, be it coronavirus, be it HIV. Work hard, exercise, and enjoy life happily all the time. Thank you.
All right. Thank you so much. Thank you, Mr. Phillips. We thank you so much. We hope we're going to meet again next time. To all the listeners, I'm Ali. I'm leaving everyone. And thank you so much, guys. Please keep on checking our website. Keep on turning in. And please, guys, always, each and every day, check your yoga. Always check us and, enjoy yourself. Thank you so much, Mr. Felix. Chara, thank you.
Thank you. I appreciate it. Thank you. Bye.